Hey guys, this is Greg with Medical Muscle. In this video, I'm going to talk about basically everything you need to know about the first 2 years of medical school, specifically at St. George University, but this can also be applied to other medical schools. Okay, so let's get into it. So the first two exams that you have at St. George University are the Fundamentals to Medicine. You have two exams. They're going to be the easiest exams of your medical school career. Now, for some people, they might be a little shocked because the content is going to be at a medical school level. So it's going to be quick, but it's manageable. I can tell you that I didn't have a hard time getting A's on those. As long as you just study your butt off, you'll be fine. Okay. They basically cover cells and cell biology and different organelles and genetic conditions that are associated if any of those things are messed up, that kind of stuff. Super easy. Now, MSK is the third exam that you'll see at St. George University. MSK is tough, the musculoskeletal system, and the reason why it's tough is because you're required to memorize every single muscle on the torso, the hands, the feet, the face. You need to know those muscles. You need to know their innervation and their action. You have to know all those things because you're going to get a few very first order questions that should be slam dunks where they just ask you, this is the muscle, what does it do? Or what's the nerve that innervates it? Or there's a nerve that innervates this muscle, which muscle is it? Those kind of questions are rare and they're easy, so you must get those, okay? Now, the harder part of MSK, and this is what really is challenging for most people, is they'll show an x-ray of an arm, an upper arm, and the shoulder's dislocated. And they'll say something like, what action are they now not gonna be able to do? Or are they gonna be weak at? Okay, that's a good clarification. Weakness versus not being able to do the movement at all. Okay, so if it's weak, that means that there's other muscles that also allow a certain movement. You need to know which movements would absolutely be cut off with a shoulder dislocation, which ones would still be functional, things like that. And it's a third order question because you need to know what the nerve is, obviously, and you need to know what that nerve innervates, what muscles, and what those muscles do, what their function is. So very tough. They'll have other things with like elbow dislocations, arm breaks, wrist breaks. You need to know if there's nerve is injured, what will the person lose? That can be very tough for some people. Okay. Another really high yield topic. I know I hate high yield, but I always feel like there was one or two questions. For sure, you're going to see a question on lymphatics. Okay. What is the lymphatic drainage of the upper arm? What's the lymphatic drainage of the leg? I think there was even one of the torso. So that can be pretty tough, and you have to cover that. All right. Now the last exam of term one is CPR, cardiopulmonary renal. So this is your first exposure to the cardiopulmonary renal system that will cycle back multiple times as you go through the first 2 years. That's what SGU loves. So you're just learning the basics of the heart, all the medications that go with the heart. That can be pretty challenging. I remember that was pretty tough. And the renal system, diuretics, things like that, the angiotensin system, and the pulmonary system, pretty straightforward. All right, so you've completed term one. Now we're going into term two. So what I always suggest is that you do some kind of pre-study before the term starts, like get at least a week or two ahead on any break, but you might want to use the breaks, who knows? I just felt like it always helped me. So the first exam that I faced in term two was endocrine and reproduction, okay? And I gotta say, actually, just let me say this in general. In term two, Term 2 is a lot like term 1. Okay, the level of difficulty is pretty much the same. It's still a lot of first order questions, a lot of memorization, but it's just a slightly elevated level of work. Okay, so we had the endocrine and reproduction. I felt like this was the easiest exam for me. Everything was very straightforward with hormones. So you have the thyroid, the parathyroid, the steroid hormones, reproductive hormones, all that stuff. And then you have female reproduction too, which I think is the hardest part of it. Knowing progesterone and estrogen when they're at the highest at whatever phase, that can be a little confusing. But for the vast majority of hormones, I thought they were pretty easy to understand. If something goes up, something else is going to go down. Something goes down, something else is going to go up. It's pretty easy. All right. So next was DM. Slide into the DMs. No, digestion and metabolism. So the development of the gut, the innervation of the gut. Hey, listen, we got innervation coming back. And knowing the 3 germ lines, that's big, which sections, where, what stage is one developed. Lymphatics, they love lymphatics and blood supply to the rectum. Whoa, maybe not lymphatics, but definitely blood supply, okay? Hemorrhoids, that comes up. Okay. And I know biochemistry comes back in this block. So it can be hard in some ways because if you didn't like biochemistry, then it's going to really suck. But it's this almost identical biochemistry that you saw in undergrad. It's ridiculous. It's the same. Citric acid cycle, glycogen, storage diseases, amino acids, super crazy easy. You've seen that stuff before. Okay. Now the last 3 exams of term 2, I thought in some ways there's easy parts and there's hard parts. Okay, they're the neurology and behavioral disorders. Okay, so I gotta say that neurology was the toughest for me to understand. I think mostly because I had no exposure to that in undergrad, 0. Or anything in the MCAT. The MCAT required nothing of neuro for the most part. So it's all brand new, which makes it pretty challenging. The pathways can be tough. You have to it's a lot of sitting and thinking about what you can't memorize this stuff. You have to think about what's going on and where the lesion is. It can be very tough. But I felt like a lot of that stuff was curved because, it's a hard topic. What makes it easy, though, is that you have the behavioral sciences. So, like all the psychiatric stuff, I felt like was pretty easy. You have some child development in there. When they start walking, when they start talking. Not too bad. I think the only tough part with child development, was knowing... Like they'll list off all these things that the kid can do, and they'll say, is there any development? Is there any developmental issues, or is one of these things a little behind? So you need to know what year that they should be hitting these milestones. So it's a lot of memorization, but not crazy hard. The neuro part is really the challenge. Okay, now, at the end of term 2, you do your first cumulative exam. It's called the BSCE. It's what you take at the end. I think we had 1 week to study, a week and a half to study for that, separate. But in reality, what you should have been doing basically the second half of term 2, maybe the last 6 weeks, is you're focusing on BSCE stuff on top of your current work. And one big hint I gotta say, and I think this is how you can make your life a lot easier, is just try to, on all your exams, you want to do as well as you can. But the nice thing is in term 2, you really don't have to study for the BSCE content that you're covering in term 2, because you're literally covering it right then. Okay, so basically you just need to go back and review term 1 stuff if you had any difficulty. For me, I needed to review a lot of that MSK stuff and some of the cardiorenal stuff. But the neuro, I didn't have to study any neuro because, hey, neuro was like the last 3 blocks just before the exam, so wasn't required to do a lot of review of that stuff. Okay, so that's the big exam at the end. your first cumulative exam. Okay, now we're getting into term 3. Now, I just want to clarify one other thing. I did research at St. George University. I did some reviews and then a few systematic reviews. I did the bulk of them. I did 3 of them. Did we do 3? We did 2. 2 of them between terms, basically term 2 and term 3 in that time period. I think the best time to get research in is in your second term or maybe your third term, because as you get to term 4 and 5, it gets really tough. And clinicals, forget about. I don't understand how people think they can wait to do research in clinicals. That's like the worst time to do it. There's no time. The best time to do it is term 2, if you'd like. But you know, there's people that do research in clinicals. They're the badasses. Okay, so term 3. We have biostatistics, microbiology and immunology, and ethics. So biostatistics, I felt like, is actually pretty straightforward. It's just statistics. And I felt like statistics is easy. You know, there's some things that you have to memorize, some formulas that you have to memorize, but the actual content is not that hard, okay? The question should be a slam dunk. And when you see these questions on step 1 or step 2, because they show up, they're usually a slam dunk as long as you've understood the concept. They should be. But you sometimes have to memorize a formula. You know, that's the only downside. Okay, so microbiology and immunology, very tough. I hated immunology. It was so hard. All the receptors and the whole pathways on how immune cells get activated, it was just tough. I felt like it was really dense, okay? And microbiology, like the biology of bacteria, the biology of viruses, the biology of fungi, you know, and how they activate the immune system. It was kind of tough. I thought it was a tough concept. And then ethics, okay? I'm gonna say this is like the cars section in the MCAT. It feels like you really can't study for it. You do study for it. You just have to get away with picking the answer that you think is correct, because you need to know what medical schools and the step exams need you to know what's correct, okay? All right, so you need to know what is the correct way to answer that question. That's it. They're tough. They're really tough. Those questions are very tough because they can all be answered, like, they're all individual. It depends on the case. Everything, it depends on the case. Okay, all the ethics questions. You have to consider everything. It's not like a cut and dry, easy situation. So that's the hard thing with ethics. I think you just have to get a lot of exposure and you'll be fine. All right, now, here are the tough ones. We have term 4, okay? Term 4 is where you get your second overview of cardio, renal, that kind of stuff. So your first exam is fundamentals to clinical medicine. So you have some clinical medicine stuff that's incorporated in the lectures, but it's not tested on. They just give you that information during the lecture. So what's nice is that content is kind of like freebies. You need to learn it for when you get into clinical skills, which will help you when you are getting letters of rec or something like that, but it won't be tested on really in anything, right? Actually, it might be tested on your shelf exams and step 2 stuff, possibly. You in this first exam, you also have pharmacodynamics, pharmacology, and skin and bone pathology. The skin and bone pathology is the hard part. That's which gets a little nasty, because especially skin pathologies, there's a lot of them, and they can look very similar. There's a lot of variety, and you need to know what they look like. It's a lot of identification. This is where Anki is very helpful. Any skin path, boom, Anki's the way to go because it's a memorization of an image. Okay, next exam is the CRS, the cardiovascular and renal system. So here's the second time looking at the cardiovascular. In term 1, you saw cardiorenal. Now we're seeing it again, okay? It's a little more in depth. You cover more things. I think it was more development of the heart, just more pathologies. The cardiorenal system is cardiorenal and pulmonary are the biggest systems that are covered in step two, step one and step two. They just cover the most range of things. So just need to know that. The third exam in term 4 is RHS, the respiratory and hemopoietic system. So you have more respiratory pathology, some of them that can get pretty gnarly. And then you have cancers and you have malaria, and all the medications that you need to know for cancer treatment and malaria. Okay, now the last exam for term 4 is the digestive, endocrine, and reproduction. See, you're seeing a repeat of the stuff you saw in term 2, term 1 and term 2 now, all in one block, or all in one block. So, yeah, you're getting condensed every term. You're getting more condensed, more material, and that's what makes term 4 harder. That's why I say I don't think it was a smart thing we published 3 more papers while in term 4. It was crazy. That was an insane thing to do. No, 2 more, and then 1 between term 4 and 5. I do not suggest doing any research in term 5. It is tough enough as it is. Okay, so term 5, now you're getting into your step studying. Now we're getting into the legitimate step stuff. Okay, this is now step review, getting you primed for that, step 1. So the first exam that we had was the MNI, the musculoskeletal nervous infection. It was just a grab bag of a bunch of stuff. And that's what these exams end up becoming. They're not really designated to one specific topic anymore. It's just a lot of topics and they're blending together. And I started noticing that SGU started throwing in other questions that were out of those systems that weren't even related, because they're just wild cards. They want you to be, they want to see if you know it. That's it. So the next exam after that, which is the hardest exam in term 5. So in the first 2 years, this is the hardest exam, except for the cumulative exams, is CPRH, is the cardiopulmonary renal and hematology. So you can see the first time you see cardio in term 1, you're just seeing it with renal. That's it. And it's very basic. Then in term 4, now you're seeing it cardio and renal, but in a higher volume. And then in the last term, you're seeing it cardio, pulmonary, renal, and hematology. Pretty nutty. It's going to be very tough. All right. The third exam is GI obstetrics. I don't know. I always struggle to say that. Obstetrics. God, I always struggle saying that word. And endocrinology and reproduction. Okay. A wide range. Very tough topics. And then the final exam is dermatology, neurology, psychiatry, and rheumatology. Okay, so you have neuro and psych coming back at the end of your second year. That's the nice fluffy, well, at least the psychiatry part is the nice fluffy part. Rheumatology isn't too bad. The derm can be very sneaky. The topics are not that complicated. It's just identification. You see an image, you better know how to just memorize it and know what that is. And then at the end of term 2, you have the BSF-CR. Okay, this exam, again, you have like maybe a week to 2 weeks to study for this. I can't remember. That's a cumulative exam of everything that you've seen over the last 2 years of medical school. So it's like your entry exam. Basically, it's a mini step, okay? So they're trying to gauge, how well you're going to do, and if you're ready to take step, okay? And some people don't pass this. Some people, for us, they were 2 separate things. So you would finish your term 2, you'd get a grade for that, and then as a separate thing, you'd have BSF-CR. So you could pass the term, but then fail BSF-CR and have to repeat BSF-CR. You could fail the term, but then pass BSF-CR, okay, but still have to repeat the term. little weird. It's whatever. I just as a little clarification, throughout term 5, that's when even in term 4, I would say I would have preferred to start doing some AMBOSS during term 4. Definitely during term 5, you should be using alternative study methods, not just the school's material. I mean, yes, SGU is giving the exams, but you got a big exam coming up, which is step 1. So you can start breaking into USMLE-RX. I love that. It was a good study tool. It had a link with First Aid, which made it really nice. It was like really quick and easy to study stuff. UWorld, obviously. UWorld is a great tool. And then maybe AMBOSS if you have some time to do extra questions. It's just the time where you're doing your final, it's like a review. Term 5 is just a review of all the things that you've covered and basically just little minor details that you need to clarify. And then that's basically it. And then you take step. All right, step 1. So guys, I hope that was a long video, 21 minutes. I hope that was good. I hope that was informative. And I hope you guys can go out there and kick some butt. Okay?